Hi guys, Dr. Gardy here with Backbone Wellness right here in Cincinnati. Okay, so now patients have asked hundreds of times over the last 20 years. They say, Doc, what's the difference between a herniated disc and a bulging disc? Great question, right? Because if you've ever suffered from disc pain or back pain or sciatica, or maybe you've had an MRI, or maybe you've seen a bunch of different doctors all over the place and they're telling you a bunch of different things about having a bulging or herniated disc. And when we're in pain or we're hurting and we don't know exactly what's going on, that can be scary, right? So, we see it all the time. So today, let's empower you so we can properly set you on the road to recovery. Okay, we're going to start with fallacy number 1. Just because you have a bulging or herniated disc, this does not mean that you are necessarily in pain. Now, by that, I mean if we went to Kenwood Mall today and we took a random sampling of a bunch of 50 or 60-year-old people and we gave them all MRIs, right? Most of them would have bulging or herniated discs, but causing them no pain at all. Now, you haven't heard that one before, have you? Okay, so if that's true, what's the deal with the ones that are causing pain? Yeah, the answer is a disc only causes pain when it is touching or it's compressing the nerve. If the disc is not touching the nerve, guess what? It's no pain. Does that make sense? So, a disc is like a shock absorber between the two bones. You have the bone above and the bone below. And if a disc is bulging, that means simply that it is like pushing out from one side or the other, between the bones of the spine. So, it's supposed to sit directly underneath those two bones. But if it starts to push out, it's like squishing a balloon. It's still intact, but it pushes out the front side or pushes out the back side. And that's a bulging disc. And again, if it pushes out far enough, it can aggravate the nerve, and that's where you feel pain. Now, if it doesn't push out far enough, enough to touch the nerve, you might have a bulging disc and not even know about it. So what makes a herniated disc? So it's a little bit different, right? Because when the inside of the disc has broken through and gotten to the outside. So it's like squashing a jelly donut. I think this is a better analogy. So your disc is made up of 2 primary fibers. On the outside is the annulus fibrosus. That's the donut part, okay? And the inside, that's the nucleus pulposus. Now that's the jelly. Now if there's a tear in the donut, the jelly will push through the donut, right? Does that make sense? So that's a herniated disc. And again, you only feel pain if that disc is touching or compressing the nerve. And when that happens, you'll know it because the symptoms in your back, it might go into your glute, into your leg, or if it's really bad, it can go into your feet and your toes. And it can cause sometimes excruciating pain, like for sure, right? Or coldness or numbness or even weakness, depending on what level of your spine the nerve is being touched. And if you've ever lived through it, you know that it's no joke. It can ruin your life, and it usually doesn't go away by itself. So with that said, the good news is that in the office, we have specific and extremely effective techniques in the office that we use to get discs off of nerves, and then we take the pressure off that area because, when we can get that disc material to go back to where it belongs, get it off the nerve, get it off the spinal cord, it helps people prevent surgeries, it gets people off of pain meds, and it can really help you to get your life back. And I love it, right? So I love seeing people get better. And we see it in the office every day. So if you or someone that you love needs help, or you would like someone to talk to at least, you can go ahead and message me or give us a call, and if we think we can help you, we'll tell you. And if we don't think we can help you, we'll tell you that too. Okay, thanks guys.